Catalina Vargas is the country director for CARE Colombia. She joins us now live from the Venezuelan capital of Caracas. Catalina, thanks so much for being with us here on Al Jazeera. Look, as Lucia Newman mentioned in her report there from Pereira, it's been more than 72 hours since the earthquake struck, and that means that hopes of finding more survivors are fading. Where do things stand right now when it comes to the overall rescue efforts in Colombia?
Thank you so much for having me tonight. I think it's important to mention that even if all the rescue teams has been focused in capital cities, there are less information about the rural areas. And one of the big the departments that have been affected, that is Chocó, with the highest rate of poverty, around 60% of people under the line of poverty prior to the earthquake. So it's definitely a priority to give visibility to the rural areas, but also Chocó at this point.
Catalina, you mentioned those more remote areas. I wanted to ask you about that because there has been a huge effort put forth to ensure that aid workers can reach those locations that have been impacted by the earthquake outside of the bigger cities. Have your teams been able to get to those more remote areas? And if so, what are you learning so far?
Definitely. Our priority is to specifically reach those areas because Colombia's topography is mountainous, so it's not easy to reach. And because of the earthquake, some of the infrastructure have been severely damaged. So our teams were deployed since the day after the earthquake in those areas where they found people that have lost their homes, with a lot of infrastructure damage in related to medical services, schools, and for sure those areas have less visibility, and it's important to highlight the current needs around food assistance, but also shelter provision and hygiene items. Also the differentiate needs for women and girls, because they, even if they were also affected, their needs require a specific approach to be covered.
Catalina, it's important to point out that even before this earthquake struck, millions of people in Colombia were already in need of humanitarian assistance. Could you just walk our viewers through the kind of severe strain that Colombia has been under due to things like ongoing conflict or poverty? And how does that further complicate things right now?
This is an important point because this disaster did not start on the 10th August. Colombia, as you mentioned, was already living one of the most complex humanitarian situations in Latin America before the earthquake. So we are talking about 9.1 million of people that were requiring humanitarian assistance because of decades of armed conflict. That armed conflict became with internal displacement and also clashes. The communities are among clashes between the armed groups. So the earthquake arrived on top of that situation, creating more gaps for the communities to get access because some of the areas are controlled by armed groups. For example, when we are talking to Chocó, this is one of the areas where there is presence of armed groups, and it's difficult to reach because, for example, Chocó is reachable only by river or a small aircraft. So that implies more challenge to provide the humanitarian support. So right now we need to give the level of the importance to this crisis because it's a humanitarian on top of a humanitarian prior crisis.
Catalina, I know that you're the country director for CARE in Colombia. You are currently in Venezuela, I was told, because you were responding to the Venezuelan earthquake. Look, I saw a quote from you in which you said that the fear of aftershocks is bringing another layer of fear and uncertainty for those coping with the earthquake's aftermath. More than 130 aftershocks have been recorded since Monday in Colombia. How much more uncertainty does that cause to those who have already been impacted?
Those aftershocks are critical because those arrive in the middle of the people who have lost their loved ones. So they are already in uncertainty about what came next. Some of them are close to the buildings that has been already collapsed, and they are waiting for some news. So when you have the aftershocks, it creates a lot of fear, and it's the reason why psychosocial support it's a priority, and mental health became something important for the responders to ensure the first aid in mental health.
All right. Catalina Vargas is the country director for CARE Colombia, and she was joining us there live from the Venezuelan capital of Caracas. Catalina, thanks so much for taking the time to bring us up to date. We really, really appreciate getting your perspective.
Thank you so much for giving visibility to this crisis.